Dementia and Alzheimer's disease are related but distinct terms. Here are the differences between them. Definition: dementia is an umbrella term that refers to a set of symptoms affecting memory, thinking, and social abilities to the extent that it interferes with daily functioning. Alzheimer's disease, on the other hand, is the most common cause of dementia, accounting for around 60 to 70% of all cases. Dementia can be caused by various conditions, including Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal dementia, and others. Alzheimer's disease is a specific form of dementia and is characterized by the accumulation of abnormal proteins, amyloid plaques and tau tangles, in the brain, leading to the death of brain cells and the subsequent decline in cognitive function. Progression: dementia is a progressive condition, meaning it worsens over time. The rate of progression can vary depending on the underlying cause. Alzheimer's disease typically progresses slowly, with symptoms gradually worsening over several years. Symptoms: dementia and Alzheimer's disease share similar symptoms, such as memory loss, confusion, difficulty with language and communication, impaired judgment, and personality changes. However, the specific pattern and progression of symptoms can differ depending on the type of dementia. Diagnosis: diagnosing dementia involves a comprehensive evaluation of a person's cognitive abilities, medical history, physical examination, and various tests, including blood tests, brain imaging, such as MRI or CT scan, and neuropsychological assessments. Alzheimer's disease can be definitively diagnosed only after death through a brain autopsy. During life, doctors diagnose Alzheimer's disease based on a combination of clinical symptoms, ruling out other possible causes of dementia, and using imaging and biomarker tests. Treatment: currently, there is no cure for dementia or Alzheimer's disease. Treatment approaches primarily focus on managing symptoms, improving quality of life, and providing support to individuals and their caregivers. Medications such as cholinesterase inhibitors and memantine are commonly prescribed to manage symptoms in Alzheimer's disease. Non-drug interventions, such as cognitive stimulation, physical exercise, and social engagement, can also be beneficial. It's important to consult with healthcare professionals for an accurate diagnosis and appropriate management of dementia or Alzheimer's disease, as individual cases can vary.